Well, I appreciate the opportunity to be here, and I hope that you guys are still awake enough to ask some questions. When I go through this process, I wanted to go through a little bit of the journey before I got to the status, and then talk about what direction we need to head, and obviously the breakthroughs. When Indra Nooyi, CEO of PepsiCo, addressed the Midwinter Conference at the Food Marketing Institute in January of 2008, she had an important message on childhood obesity to deliver to her peers. We can do something, and we should do something. Indra knew that more than 1 in 3 American adults and nearly 1 in 5 American children were obese. She knew about the potential health consequences of obesity, type 2 diabetes, hypertension, cardiovascular disease, and many others. And while the companies in her industry were making changes in the marketplace to provide lower calorie options to consumers, critics were either unaware of the industry's efforts or skeptical of the results they would produce. At that time, the food and beverage industry recognized the need to become even more visibly active and engaged, and so when challenged, there were already a group of CEOs who were quite eager to lead. In the fall of 2009, some of the country's largest food and beverage companies and retailers started the Healthy Weight Commitment Foundation. They set out to do their part in addressing the issue of obesity by focusing on 3 key elements that would determine our success. Make a significant marketplace commitment with its findings evaluated by an independent outside evaluator. Put our resources behind a consumer education campaign and open our doors to any organization that was looking to participate. In 2010, the First Lady asked the industry at a GMA meeting to step up their efforts as part of her Let's Move initiative. We were already engaged in a conversation with the Robert Wood Johnson Foundation, but we felt that all parties agreed that we could really jumpstart this effort if we joined with the First Lady and made the first commitment with a Partnership for a Healthier America. So the 16 Healthy Weight Commitment Foundation food and beverage companies addressed this call to action by committing to remove 1.5 trillion calories from the marketplace by the end of 2015. We examined a number of studies, some of which were shown today, that estimated how many calories per day per person would need to be reduced to close the energy gap. However, what we really were doing, and what we didn't quite realize, and Larry is really the person that's been responsible for this, is we started a calorie capital campaign. As a result of the positive efforts of Partnership for a Healthier America, others like Darden Restaurants, the nation's largest restaurant company, and Walmart, the largest retailer, have significantly added to that capital campaign by providing greater choice and variety to their menus and their shelves. So it's not surprising that when the biggest players step up, the impact of their efforts is disproportionately large, and the momentum they generate is in the right direction. On May 30th, the Healthy Weight Commitment Foundation companies provided an interim report to PHA that we had achieved and exceeded our 2015 goal of removing 1.5 trillion calories from the marketplace. However, I know we are all looking forward to Robert Wood Johnson's announcement that will give the final calorie count in their evaluation. So through this process, what we've seen is that since the Healthy Weight Commitment Foundation began, America has seen a decline in food supply calories, as noted by USDA's Economic Research Service that concluded calories available in the food supply have declined over time. CDC experts citing NHANES data have reported declines in energy intake in both adults and children. So again, you've had a decline in food supply of calories, a decline in calories consumed, and a decline in calories sold. And this is a trilogy of achievement which everyone can be proud of. However, if the question was asked is, are we headed in the right direction, and which direction do we need to be headed in? And the answer is we need to keep moving forward. It's not only a story of achievement for the food and beverage companies that participated in this process, but it's really an achievement for the American people. A May 2013 Hudson Institute study found that lower calorie products drove 82% of sales growth among the food and beverage companies that were part of Healthy Weight, more than 4 times the sales growth of higher calorie products. The sales of lower calorie food and beverage products increased by more than $1.25 billion, compared to $300 million in sales growth of higher calorie products. And of the 15 new products attaining annual sales of $50 million or more, a major benchmark in industry, 10 were lower calorie items. Based on this data, the Hudson Institute recommended that companies should emphasize selling lower-calorie foods and beverages as an effective pathway to improved overall sales growth. In other words, selling more lower-calorie foods and beverages was just good for business. We're going to be tracking these commitments. We'll look at key indicators like the sales of lower-calorie products and the availability of lower-calorie products. But also investments are being made to give consumers more informed choices through things like clear on calories and facts up front. I don't need to tell this audience that as we look to the future, it's critical that more organizations and community join Healthy Weight, Walmart, Darden, and PHA, and so many others in their commitment to make changes in the marketplace. Consumers have a range of choices where and how they consume food, but everything needs to be holistic. It has to encompass that ever-growing range of companies, and there have to be commitments by schools, moms, dads, and caregivers. Oh, didn't realize that wasn't up there. But when we talk about breakthrough, I see breakthrough in two different ways. In addition to changes in the marketplace, companies can also provide business processes and expertise to obesity reduction programs of nonprofits, schools, churches, and so many others. With these tools, we can create sustainable, integrated systems that operate in a cost-effective manner, in fact, in a manner that reduces cost on an annual basis. So I anticipate great breakthroughs in the application of these continuous improvement systems that are so prevalent in manufacturing for the delivery of nonprofit services. And through those techniques, I see barriers that are inhibiting success falling. What I'd like to do is step back for a moment and explain my thinking to those of you in this room, particularly those who have resisted in the past engaging with the private sector. I recognize that most people within the Washington and policy circles sometimes view business strictly in terms of the end products and services that they sell and that they market. For the last 30 years, I've had a unique advantage, which is that I've actually worked for 3 completely different sectors in the manufacturing world. I worked in high tech for 15 years, the auto industry, and now the food and beverage manufacturers. And while working with companies that were Intel and Toyota and other large multinational manufacturers, I learned that if you applied these processes to public and nonprofit sector programs, especially in a time of greater and scarcer resources, we could create solutions. And we could create solutions to social challenges that again decline in their year-over-year cost. Whether the service was improving math and science education in the schools or launching a World Expo in Japan, which I helped do in 2005, what we've learned is that if you open the door for business to provide other types of services, that actually working together, which we have the opportunity to do with this collaborative, we can really move things forward. I came to believe that combining that assembly line principle of carefully defined sequential tasks with rigorous standardization and giving the flexibility to create line extensions, something that makes these companies very successful, could lead to a reinvigoration of our public and nonprofit sectors. And so we took these products and these standards and these ideas and we decided to apply them to our own programming. We developed a relationship with mature content producer and distributor Discovery Education, the #1 digital curriculum provider in the US, reaching over 53% of the elementary schools. We then aligned our standards-based curriculum and content to the standards of critical government programs and apply business processes to streamlining and enhancing our delivery service. We use sophisticated, highly flexible social communications techniques. We tapped into mature delivery systems, but we maintained the fluidity to scale up and scale down whenever we needed to. All of this has allowed us to focus on customer-focused programming directed to those with the greatest need. Plus, we also made everything open source, free, and easily accessible. In conclusion, whether we conduct public education campaigns, provide consumers with lower calorie options in the supermarkets and restaurants, or work to increase the nation's consumption of fruits and vegetables, we are providing our customers with the information and tools they need to maintain a healthy weight. And I should point out that the term "our customers" is for everyone in this room. Each of us have our own customers that we serve. By working together to solve the obesity challenge, all of us have known that our collective effort is stronger than our individual parts. The greatest breakthrough action for the next 3 years will be the entry of new commitments in the marketplace, the effective alignment of all of these high-performing efforts that have launched in recent years. We'll have to enhance our ability to fill gaps, reduce barriers to success, and continue to focus on the individuals and the communities with the greatest need. As said previously in the last session, there are no silver bullets, but if we effectively orchestrate the delivery of goods and services, it will allow families and schools to use the programs and services we at Healthy Weight and those in this room have created in a manner that most effectively fits their local and individual needs. And that is one reason that I was very pleased to be invited to participate in the roundtable, so thank you.